Well, good morning, everyone. Happy Friday. It's great to see you all this morning. We have a wonderful interview coming up with Dr. Cassandra Germain. She has a number of roles and titles that Heather and she will go over during the interview, but I did want to share she's one of our wonderful coalition members, and we're so excited to have her this morning. And also that our coalition recently partnered with the Center of Excellence in Integrative Health Disparities and Equity Research, where she serves as co-director. So we are so excited to collaborate more with the center, and I know we'll get into that a little bit more here in a minute. But a couple quick announcements. First, just make sure your calendars are marked for our monthly meeting, August 18th at 11 o'clock. Also, please make sure these Friday facts are on your calendars. They occur the second and fourth Friday of each month at 8:30. And other than that, please introduce yourselves in the chat, say hello and good morning, and share any questions you have. Heather, I'll pass it over to you.
I am jumping in because we have so much to talk about. Welcome, Dr. Cassandra Germain.
Good morning, everyone.
Hi. Okay, I'm going to do your titles just so I can brag on you a little bit. You have some co-director of the Center of Excellence in Integrative Health Disparities and Equity Research. You are the lab director for the Aging and Wellbeing Lab. You're part of the Department of Psychology for North Carolina A&T State University. I'm so excited to have you here, and I started to say it before we started recording. I'm already annoyed that we're not going to have enough time. So I'm warning you, I'm warning our wonderful audience that this is going to be part one, because we have so much to talk about, and I'm already upset that we can only probably stay at kind of a surface level. But welcome, Dr. Germain.
Thank you. Thank you.
All right.
Thank you for having me.
And you helped me with the acronym CITER. We were so excited to learn about the center, CITER, the tighter name for the Integrative Health Disparities and Equity Research. We're so excited to get into the Aging and Wellbeing Lab. But it is a tradition here with Friday Facts to have the first question be all about you. Tell us about you and your background, where you're from, and what experiences shaped your work now.
Ooh, quite a bit. So I'll give you the abbreviated version. So I'm originally from New York City. And for some reason, I've always gravitated towards elders. So I think aging was always in my life and in my future. And I've always had a close relationship with my grandmother, who ironically, right around 7 or 8, inspired me to become interested in aging and memory in particular, because she was the only adult that I ever knew that had to search for her keys in her purse on a daily basis. So that always fascinated me. And I thought, even as a 7-year-old, I'm curious about this. And later, as an adult, after I earned my PhD, and I actually ended up becoming her caregiver, because she did develop Alzheimer's disease and dementia. So it kind of came full circle and really influenced my passion. Initially, when I started my work and my interest in cognitive disorders and memory decline, I was looking more just traditional processes and not doing much caregiver work, but just having that hands-on experience of being a caregiver and seeing, the changes in her, looking at different ways in which her function changed, and having to navigate that while raising a family and maintaining a full-time job just gave me a very different perspective. So yeah, that's about me.
Well, I'm so glad you shared, and we're going to dive into that. And of course, as folks know, I always read about research, otherwise known as stalk our guests. So I saw that, and I saw that you were also a family caregiver, and I'm happy that you did share your personal connection with caregiving and with family members with dementia. I wondered how that influenced your path, both academically, professionally, research interests.
Yes, absolutely. So as I mentioned, I earned my PhD from North Carolina State University in human development, and subsequently I completed a postdoc at Duke at the Center for Aging, focusing on epidemiology. And I think, again, as I mentioned, my interest primarily was on looking at, causes and risk factors for dementia, but becoming a caregiver and working a little bit more in the community, seeing where the gaps of care are. I mean, I still continue to do some of that work, but I've become a lot more interested in doing a little bit more engagement and education work in the community, especially around marginalized communities, low income and minority communities who don't seem to have as much access to education and awareness and information for screening purposes as much as we'd like. So we are doing a lot more of that in my lab, and also giving caregivers tools to, help them increase their quality of life and to help preserve the quality of life with older persons who are living with dementia. And music intervention, which we talked about a little bit, that we do in my lab, is one of the ways that as a caregiver that I became a lot more interested in that and have been doing a lot more of that work. And what we are doing in the Aging and Wellbeing Lab is where first we would go into the community, into adult daycares to expose persons with dementia with music. And we found that music really helped to engage them in a very different way. I mean, I'm sure those of you who have experienced, most people who are interested in Alzheimer's disease and aging work have some personal experience, I found. What we found was that it really helps to revive their autobiographical memories. It helps to elevate their mood. It really engages them on an interpersonal level. And it's very easy when you're caught in the day-to-day care to kind of become emotionally disconnected when your loved one doesn't remember you, or they're having challenging behaviors. But music, especially music that is related to their history, personal history, and their past, really helps orient them. It helps with agitation. It helps bring families closer together and just remind you that, still there and you can still have joy in the midst of the storm. And we've been doing a lot more of that in the community in adult daycares, and we'll be launching a study in the fall where we're going to train caregivers on how to implement this at home virtually.
Oh, I love that. And I love all the work around music and caregiving and dementia. And I will say that since as a coalition, we focus so much on advanced care planning, what I often tell people, joking but also serious, make sure your family knows what music makes you happy and gets you going. That should be part of your planning for the future. And I love it, even in the 5 wishes document, I know with my own parents listing that music, but I say, okay, this is the station I want. So I'm so glad you're doing that in the work, and clearly your interest and focus area, both personally and professionally, on caregiving. I know I'm looking at Karen Appert, I'm looking at Harold Barnett. I mean, those of us that are entrenched in the caregiving and caregiving advocacy world. So thank you for saying a little bit about the Aging and Wellbeing Lab, because there's so much to talk about. So I'm glad you brought up the lab, and folks, feel free to help me out if you have questions, but I've got a ton. Now moving into your work with the center, I was struck by the center's description. I'm going to look at it and your mission statements. I won't read all of it, and I encourage all of you to go to the website. The link is really long, so I can't easily say it, but we'll list it with your video. But to share just a little, I was drawn to the statements. Health disparities and equity research is complex and multifaceted. To work towards the alleviation of these disparities, the center formulates new, relevant, and transformative research, theories, and models to bring greater clarity and understanding to health disparities and health equities and create solutions. I really want to dive into that, and also your journey from the Health and Wellbeing Lab and working with older adults into now co-directing health equity research and how those link together, and then jumping into those solutions you're working on. How's that for a loaded question?
That is a loaded question. So, the Center for Center of Excellence for Integrative Health Disparities and Health Equity is a new center and initiative that is being supported by our provost and our chancellor at the University at North Carolina A&T. We are strategically located in East Greensboro, which is a very diverse area, both economically and ethnically. So there are a lot of immigrants, refugees, as well as, historically African-American population. And of course, as our description says, equity and health disparities are caused by a host of not only, health biological factors, but in particularly influenced by a lot of social and environmental factors as well. And our center, we are going to have a three-pronged mission. So there are 3 associate directors, and our goal is to, 1, train future researchers and and future scholars and community workers that are going to be at the grassroots level to serve underserved groups. We also are going to be conducting research in partnership with members of the community and also engaging with education and outreach. And we'll do that not only with the university, but with a variety of community partners such as yourselves and, Harold Burnett. Hello, Harold. Is one of our new community partners as well. So it is a relatively new center. We were officially charged in the fall and have become official in the spring, and we have a formal partnership with Cone Health, and we had our first kickoff event on July 8th, which was a Building a Better You, a wellness event, which we held in East Greensboro. And really what we're going to be doing is a series of community outreach events with Cone Health to help increase people's awareness about their access to healthcare, but also to incorporate those social pieces where we can help to address some of the other barriers to healthcare, such as, access to transportation, food insecurities. And as part of that wellness event that was very well received by the community, we also conducted a needs survey to look at, what are some of the gaps in social needs that are preventing people from gaining access to better healthcare. So that's one of many projects that we'll be launching, and we look forward to sharing those results on our site in the near future.
Oh, well, first of all, congratulations on the center. I mean,
Thank you.
Also, if you value it, you measure it. But also, especially in academia, if you value it, you create a center. You really focus on it. I want to talk about education, and then I'm going to dive into, I have a research question, but not education, your education, your outreach work. I was really struck when I read about your connecting out into the community. I know from my own community organizing efforts, it's really hard to make inroads. And I was struck when you talked about your work to build, when I was reading, sustainable and trusted relationships with minority ethnic groups and economically disadvantaged populations who bear the burden of disease. And I know how complicated it can be to build sustainable and trusted relationships. Mm-hmm. So how has it been received in the populations that you're working with? How is that going?
Again, so we are a new center, but I think what we are strategically doing is because the center is multidisciplinary, we're engaging faculty members and members of the community who already have existing relationships to form our partnerships, because we think, there are so many people doing wonderful work, and our job really is to bring people together so that we can truly meet the needs of the community. Because as you all know, no one agency or no one institution can really meet all of the needs that there are. So in our strategic partnerships, we are being very intentional about, ensuring that we're not only focusing on the academic piece and the research piece, because I think, historically, one of the reasons that we have mistrust, aside from, abuse, like things like such as Tuskegee study, but also, academic communities have a tendency to just kind of come in, conduct a research project and then disappear, never to be seen again. And, that makes people in the community kind of resistant to being more responsive. So our approach and also Cone Health's approach as one of our recent partners is to really establish a sustained efforts and to engage, again, community grassroots agencies that can also help to continue that work. So at the recent event on July 8th, we had the Department of Public Health there. We had the food bank there. Of course, A&T and Cone Health were there. There were actual screening stations. We conducted a survey where we can direct people to where their needs can be met. And the goal is for it not to be a one and done. So based on what we find in our needs assessment, the goal again is for us to strategically plan and to not only have it in one location, but to increase access by moving around East Greensboro so that it's a visible presence and people can actually have access to tangible goods and services that, or at least become more aware about tangible goods and services that are going to help meet their needs in the community. And of course, so there is a way, it is effortful and it has to be strategically designed for us to meet these needs. But we find that if you have strategic partnerships and you have a long-term plan, then it is something that can be done.
Well, and it's beautifully said, and the concerns are real, and it's been my experience since I'm based in an academic community, and that a community members sometimes feel we're your guinea pigs for research, and that one is that you're going to come in and we're there for your research, but are you really there for us? And I know, and I've seen it, it takes time, and literally show a year later, 5 years later, we didn't go anywhere, we're there for you. So I'm so excited to hear more about that. And I know there's probably a group of us, we can talk offline about how to continue to build those relationships. The other one of the 3 pillars or the 3 focus areas for the center that I was really interested in, and I thought our membership would be too, is the research focus. In our previous conversations on Friday Facts and other conversations we've had around health equity discussions, we've wondered how to truly conduct meaningful and actionable research. What is the way that we can do things quantitatively, qualitatively, that can help move conversations and move action forward? And I was struck by what you shared and what I read about that you're very intentional in how to develop methods, technologies, and best practices to conduct basic translational and behavioral research that address health disparities. So I was really curious, what has been your approach to research development? How are you finding research to be helpful and actionable, as opposed to we're counting, but we're just continually showing problems, but not showing
solutions? So there are a couple of different approaches that can be used at that. And some of it can be very discipline specific, which is why we are interdisciplinary center. We do have people who are working with, lactation consultants in the community. And I found myself that speaking to people who are at the grassroots level is really a wonderful way in getting the community involved. So I know that one funding agency, the PCORI Center, I'm not sure if you're familiar with that, and also the National Institute of Health and National Institutes of Aging as a whole are really moving towards interdisciplinary teams for that purpose. And, being able to kind of looking at the quantitative questions that, we do need numbers, and those are very important, but also taking more of a mixed method approach and incorporating, key members and stakeholders in the community is an important way, because as, academics or as researchers who may be focusing on one aspect of the problem, but there are other aspects of problems, again, that are more complex and more nuanced that we may not necessarily think about. But when you engage stakeholders and when you engage, individuals, members of the community who are directly impacted by, the problem that you're trying to address or the solutions that you're trying to create, especially when we get to creating solutions, especially, then you find that, that you have to make some modifications. And I'll use an anecdotal story. So in my research, for example, we found that in the beginning, we would interview individuals and their families and ask them, okay, well, what kind of music does your loved one like, or things like that. Let's say particularly if in the more advanced stages of dementia. And, for the most part, spouses would give very good information because most of them have been married or together for a very long time. And the music that they share together is usually a very good bet. But whenever we encountered, caregivers like, children, right, or nieces or things like that, we'd get a kind of a different set of music. And what we found was, people with dementia, as they get further along in disease progression, they identify more with more distant memories. And those people may not have been active in their lives in distant memories and know the kind of music. So the music they may have identified with was from their 20s or their teens or their 30s. And not for the last 20 years when they really started having a relationship with grandma or with mom or things like that. So we would find that we would start, playing these playlists, but we would always kind of just test the waters a little bit and incorporate various music from different periods. And what the caregivers, especially if they were non-spouses, liked is not what they really responded to. So we would find ourselves tweaking the playlist to reflect, more appropriate music from their distant past. And their loved ones were frequently surprised about what they liked and what they could remember from, 30, 40 years ago, but not necessarily 10 or 20 years ago. So that's a wonderful example of really kind of being in tune with, what the stakeholder, needs or what they respond to, and making adjustments as necessary. So kind of like a living, breathing research model is a more effective way when it comes to implementation.
And wonderfully said. And I did catch the pun, even though you didn't mean it. But maybe you did, to be in tune with what you once want to hear. And I'm telling you, that's why you tell your children and the younger family members around you. And isn't it called isn't it the reminiscence bump? It's the music
Yes.
you listen to from the age of 17 to 25 that usually has the most emotional and excitement. And I know that you shared, I wasn't sure if it was offline or online, and I should say it very quickly, that you now have an Instagram account that you're getting for the center and for your work. But there was an Instagram and TikTok thing going around where younger folks, I know my teens did it with me, they played music. They said, play this for anyone who's 52 and see what happens. And it immediately brought me back to 80s. And so they have So I think some of the younger generations, it's become kind of a fun thing to figure out what music can make your parents dance just by.
That's right.
So you can link those to your fun new Instagram post.
Yes, I will. Absolutely. It's a great idea.
So, and you mentioned, I realize, and a follow-up to the research, but you mentioned PCORI, and it's such an important group. And just in case people don't know what that group is, if you could share what that organization is, PCORI, or the federal group.
Yeah, okay, so yes, I always forget. So it's a person.
I know, I'm making you do it, not me. I know outcomes is in it.
Yes, yeah, a person-centered outcomes research institute, I believe is what it is. And they're, yes, we're just giving you a thumbs up. So I remember that correctly. I was about to go Google it on the side very quickly.
Oh, it was more that I wanted the folks that is really outcome oriented research. And so that's why, again, there's knowledge for knowledge sake, but it really is much more, again, actionable and outcomes focused. I had a brainstorm, and I shouldn't ask you online, but I'm going to do it. So as you were talking about your research topics and thinking through, I realized there's a number of us that as we talk, especially around health equity efforts, that we might come across, I wish people were capturing it this way. I wish people were asking these questions. Since you're a new center, not that, because our questions don't come with funding, but could we funnel that to you and say, here as a coalition, we're thinking about these issues, we're struggling, we don't see people talking about it, but we don't have a research center. Let's send it to Dr. Germain. Is that possible? Can I ask a little?
I think, yes, absolutely. I think that is a wonderful thing to be able to do. And actually, if you all are open, please, number one, I'm going to put a plug for Cider. Please follow us on Facebook and Instagram, because we are trying to generate our following, and I'll put the information in the chat. But also, we will be launching our speaker series. We usually have one throughout the academic year to bring light to issues going on in the state. So I would love to invite if any of you are interested in speaking at our speaker series, we would love to have you do that. So if you can just I'm going to put Cider's admin here, just go ahead and send an email to Cider, and we would love to get you on the schedule to speak at Cider.
And we will share all of that with our group as well, because with our few minutes left, I do want to continue to talk about ways we can partner together. You are a member of the coalition, and as Virginia shared, the Serious Illness Coalition is now, what are we listed? We're an official formal community affiliate partner with the center. So we
yes,
married.
We are married.
And so as we think about ways that we can help support, and I'm even looking at our membership, and I'm looking at our boxes, and I see Venitra White-Dean, who runs a wonderful foundation and support group for caregivers in the Charlotte area. And so all of our members represent different provider groups, advocacy groups, support groups. We'll support in the broadest way. And so it will be neat to find other ways for ways we can connect. Are there asks that you have of us, or already ideas of how we can help to promote your work, either through the Aging and Wellbeing Lab or through Cider? I don't want to go to, sorry. My computer just went off. Sorry. I don't want to go to acronym and lose again your integrative health disparities and equity research.
Yes.
So is there, my computer's doing weird things. Are there ways that you want us to be able to help partner together?
Yes, I mean, for right now, again, we're just really spreading the word out about our center. If you have any initiatives, because again, many of our faculty affiliates are always looking for community members to partner with. If you have ideas, as you mentioned, or research questions that you're interested in exploring, or special community-based project that you're interested in exploring, please, reach out to the center. One of the things that we'll be doing, and we've kind of slowed down during the summer for the reasons that you shared earlier, people are traveling and it's difficult, but we'll be sharing publicly all of our community affiliates and our stakeholders who are partnering with us, including the Coalition for Serious Illness, as well as featuring different faculty members who are formal affiliates of the center and the kind of work that they're doing. So the work is very broad. We have people working on, adolescent and collegiate, pregnancy, looking at myself who looks at aging. We have individuals who are looking at, cardiovascular health and exercise, people who are interested in cancer, people who are interested in caregiving, people who are interested in sleep disturbing or substance abuse in the community. So we really have our researchers across campus are really broad and vast. So there are a lot of opportunities to collaborate either on community outreach and engagement projects, as well as converting them to formal research projects. So really just, follow us, engage with us. Please come over and join our speaker series, share information about your center. And I think for now, that's kind of the primary goal of our center as we're moving forward.
Well, I'm having fun. The caffeine has kicked in and I'm already starting to brainstorm new ideas. And I see Harold Barnett shared it. And I want to say this, if people haven't read it in the chat, it's great to finally have a center devoted to some of these issues. As we all know, linkage to institutional capacity leverages individual and group efforts in important ways. And I completely agree. And I'm thinking both with the Serious Illness Coalition, I see Mary Bethel is on, and Heather Burkhart from the North Carolina Coalition on Aging. Both of our coalitions have health equity work groups. We work together and then we create priorities, but then we kind of get stuck with what do we do with these priorities? How do we move them forward? And so again, having this direct linkage, and I'm already thinking with myself and my connections at UNC and my appointment with the School of Public Health, you are part of the full UNC, the North Carolina system. Are also, what's the word, intra and inter academically that we can, I know anyway, I can help create linkages, and we have a very powerful and influential and well-connected group. And I really, as a coalition, that's what we want to do, is be able to maximize our coalescing and linking powers. Since we don't have a funding research center, we want to help grow yours. I know we're pretty much out of time. Any last questions are asked before? This is going to be the first of many conversations, and I will say here, because I think I'm sort of can be the queen of not flakiness, but surface level. And it always pains me to have these conversations, especially about health disparities and health equity work, to talk at such this high level and so surface level that then we never get deeper. And I've already told Virginia, we got to find more ways to get deeper, whether it's through our monthly meetings or work groups. And so I both thank you, but I also apologize that we had to stay up here. But any other up here or down here?
Well, that's quite all right. Well, I also want to announce, and I'll share this with the group as well. We are, we've recently partnered as well with NC Counts, our center has, and we will be having a one-day conference, just really, again, to spread the word and educate the community about the importance of participating in the census for community level events and things of that nature. So if any of you all have an interest in that, I will share the link with Heather to share with the group for when registration becomes open, but that will be happening in September. And we'd love for you to share the word about that as well, and to encourage your constituents to go ahead and participate in the census or register for the workshop and the conference. NC Counts has a wonderful method. So not only is it educational and informative, but they also have kind of like a hands-on kind of work group so that people can understand, you know, how the impact is made when they do and don't participate in the census, because of course, as we all know, that there's underrepresentation in the census for a lot of reasons, sometimes misinformation and things like that. So we're also working with them to help influence that in preparation for the next census. So there is a conference and workshop coming up in September with NC Counts, and it's going to happen at the Alumni Center at North Carolina A&T.
Great. Well, thank you. And we will make sure to, I say we, the Royal We, make sure that Virginia posts that and shares that, because she's the she's in charge of our newsletter. I want to thank you, just so much gratitude, not just for joining us here with Friday Facts, but for joining the coalition and now being an active member, and for inviting the coalition to join this center and to join this initiative. That means a lot. And I think it's really important to formalize partnerships on both of our ends to show our dedication to this work and then to find new ways to work together. So really, thank you and congratulations.
Thank you.
And we are all now part of your fan club and help advocate for only great things for both the center and the communities that you're serving. So thank you to you. And
thank you. Thank you, everyone. Nice to meet you. Bye-bye.